questions that have come in.
Thanks very much, Stacy. And I appreciate our participants for migrating over to Zoom so that we can interact with you a little bit more. And we're a pretty small group, so I'd like to invite you to unmute yourself and feel free to engage in discussion with us. Conversation might be a little bit more interesting than just formal questions back and forth. The first question that we had that came from Sarah Anchor, and she asked about how COVID influenced the work. Specifically, she says, I recall that in the early days, facilities in New York City and other places were limiting or banning visitors entirely for laboring patients, and that caused a lot of harm. And that question came in during the time of the presentation that we were talking about the New York City Standards for Respectful Care at Birth.
Hello, thanks Diane for that question. So I'll just start off by saying the impact of COVID that we all know had disproportionately impacted Black and Brown communities throughout the country, especially here in New York City. And so when COVID came for our community partners, everything was shut down. However, the groups, they did continue to engage with community participants. So I had mentioned we have a group of advocates called Birth Justice Defenders, who these are folks who are passionate about birth justice. They themselves might have had an adverse event that happens to them at one of our birthing facilities here in New York City. So that group, they were so resilient, got together, and through funding from the health department, we were able to do some virtual webinars, really focused on questions that that particular community had questions and concerns about around the doula piece. I'm currently pregnant. Who can go into the space with me? So we provided some information as we were getting it also from the state at the time. Like it was a lot of back and forth around that until the governor finally put it into writing and say doulas can come in and be part of your birthing or supporting party. They can be part of the come in virtually. And also we did webinars just to get a better understanding around what folks really understood about COVID. We discussed where to get tested, why get tested. And then the question when the vaccines rolled out came, why should I get vaccinated? How will it impact my pregnancy? Can I breastfeed? So, and we continue to do these discussions right now, especially now that we're seeing that a lot of pregnant individuals are not getting vaccinated, and then those with children 5 to 11 are not getting vaccinated. So from a community perspective, we've done a lot of education around COVID. And we're listening to what they're asking for and what they're charging the health department to do, from giving us access and resources to having better public awareness campaigns that's really targeted and focused on communities within New York City. I'm not sure if Falake had anything else to add for that question.
Yeah, just to add to that, I think because of our engagement with these hospitals during the time of COVID, we were able to address a lot of the concerns that we were hearing from the community and from our birth justice defenders. So as Amita mentioned, we were in constant communication. We had trainings going on with the hospitals. And so we were able to bring to them these concerns and allow them to address that, or prevent their staff from disproportionately removing or having people not have support people at their bedside. In addition to that, I think we, on a population level, we have the Pregnancy Risk Assessment Monitoring System database that we use to ask folks in, birthing people in New York City. And we did have some questions in there around COVID and how COVID impacted their ability to have people support them, as well as access to their providers, and a bunch of other questions relevant relevant to their care. We're still looking at that data. We don't have our final results yet, but we're seeing preliminarily, as Amita mentioned, that Black and Brown people were disproportionately affected by not having support people at their bedside.
Thanks, Amita and Falake, and I'll go out to Sabra and ask if that answered your questions or if you have any follow-ups.
Yeah, no, that's super helpful context. I think I was kind of thinking as I saw when you looked like, and now of course I'm not looking at the slide anymore, but of like when some, like the pre-period, the baseline was established was sort of after the first wave. And so just wondering if that had informed how, like what was maybe included in what the definition of some of the metrics and things like that, if that maybe hadn't been a lot of things that had never occurred to us to like need to write down,
Yeah, and that's a very good question. I think our metrics were developed, as Amita mentioned, by the community in terms of the areas of the standards, and the sub areas really informed the things that we were assessing for at the hospitals. We did try to ask a little bit about COVID, but or the impact of COVID on those areas. And maybe that, also was reflected in their responses, but really we were looking at the infrastructure within the hospital system, the staff capacity, the trainings and all of that, which eventually would impact the way in which they care for people, either during COVID or just in general. So we wanted to really assess for those core implementation areas.
Yes, and so I know our birth justice defenders, they were letting us know that in terms of education, that really wasn't being done in the hospital spaces. We had heard some information around, folks not getting tested or being asked to get tested. It's great, but like educating them as to why we're testing you, why we're testing the baby. So education was a big part, especially like the chest feeding piece during COVID. There was a lot of lack of education that we were told that was happening for birthing people in New York City, hearing this from our birth justice defenders who were out there doing the work. And I just want to mention that during this period as well, we were able to train 10 of our birth justice defenders to become community health workers. And they really helped to educate and get more information out there and advocating for folks during the pandemic.
Thanks, Amita, and thanks, Falake. I'm going to move away from COVID and into our second question, which came from Laura Powis. And Laura asks, Falake, can you share more information about your plans for the community-involved patient feedback mechanisms that you mentioned? What would they look like?
Yes, hi, thank you for that question. Can you hear me? It says I'm still muted. Okay. So our patient engagement work has really been a core part of the implementation work at the maternity hospitals from the onset. We wanted to improve quality of care, but we also wanted to improve the experiences of maternal care within these hospitals. So we've sort of tried to work with hospitals to get them to have a system that allows them to hear routinely from the patients that they serve. We worked on developing a survey that would be integrated into their post-discharge process, but unfortunately that did not take flight. And then we heard from our state partners that they're actually working on a birth equity implementation project, which has another process, parallel process to hear from people at birth and hospitals. So we're still working right now with our state partners to try to work within that process that they're piloting at this moment. In addition to that, we are hoping to partner with using mobile technology with the Earth app, which would allow us to separate from what's happening in the hospitals and hearing from people at the bedside, we would be able to hear from people who have given birth and have decided to submit their reviews about the hospitals. So that would give us a broader way and a way of hearing from people that's not tied to the hospital within which they are receiving care at the moment. And we're hoping to use that as sort of like a right time model of patient feedback as opposed to real time. So that's our plan. We'll keep you all posted as that rolls out, but we're really hoping to hear from the community around their birth and experiences that way.
Thanks very much, Falake. And we have a third question that came in through the conference platform chat. And that question is from Naima Mohammed. And she asks, how do you provide TA, technical assistance, to hospitals and/or community organizations?
Yeah, thanks, Falake. I can start with the community piece. So as I mentioned, we have what are called Birth Justice Defender Hubs. These are CBOs that are located in our 3 neighborhoods that Falake or I believe Zolene had mentioned. These are task force for racial inclusion neighborhoods came about as a result of COVID. These are neighborhoods that are disproportionately impacted due to COVID. And also neighborhoods with high SMM rates. So we're very strategic when we identify these hubs. We fund them to support the birth justice defenders. We provide technical support through, we have bi-monthly meetings with all the hubs, bringing them together, monthly meetings. A lot of the community partners are already doing this work and passionate about the work. So a lot of times it's them providing us with TA, given that they're engaging with the community. And we really appreciate the feedback that we received, honest, brutal feedback from them. Like, how can you ask us to do this? This is not realistic. That whole community engagement and being the ears on the ground. So we do provide support that way through funding and bringing them together so they can share best practices and communicate with each other and the best ways to promote the work of the birth justice defenders.
Yeah, and to support the implementation of respectful care at the hospitals, we provide technical assistance webinars to the hospitals. So we, as part of their involvement in the Maternity Hospital Quality Improvement Network, we require that they attend these technical assistance webinars where we focus on key areas of the respectful care standards and really providing strategies for them to implement it within their hospital systems. We partner with experts in the field to do this. So we recognize that we may not have all the expertise. So we partner with other folks in the field, racial equity experts. We partner with ACOG. We partner with mental health experts to really provide the strategies needed within the clinical setting to implement these respectful care strategies.
And just to piggyback off of what Falake is saying, I think the key to this when you're bringing in experts is working with providers. What we've learned is providers listen to providers, right? So we did bring in providers who themselves are birth justice advocate and champions. That was one of the biggest lessons learned from this whole process. So part of that convening of folks and sharing best practices and having conversations, it was facilitated by providers. Well-known OBs.
Thank you both. And let me check in with Naima and ask if we answered your question.
Yes, you did. Thank you so much.
Okay, you're welcome. So we have just about 3 more minutes. I want to thank everyone who's put their email in the chat in Zoom. We would love to follow up with you and share more information about our work. So we will do that. And since we have 2 more minutes, let me throw a question out to all 3 of our presenters, Zolene, Falake, and Amita, and ask, what are some key lessons you've learned? Just short, maybe one thing that you want to throw in to communicate or share with anyone. Lessons you've learned in implementing your project that you want to share with others who might be interested in similar implementation. And I'll go to Zolene first.
Thank you, Diane. I would say a key lesson learned is that community members have a lot of expertise, a lot of wisdom. We found that our conversations were really robust. They were emotional, they were passionate, they were well thought out. This is people's lived realities. And so I would say that I think something that I learned is that there is a need for more of these community conversations to give community members the platform to share their vision of what they want maternal health to look like, whether it's in New York City or anywhere in in the country or in the world. That we should be listening to community members about what it is that they want to see. And it was really enlightening to see that across the community conversations that we have, albeit within New York City, we were hearing similar notes and similar desires and similar visions. And so I really encourage the continuation of this work, both in New York and throughout the country and the world, so that we can learn to get on pages with what communities want to see when it comes to maternal health.
Thanks, Elaine. Let me turn it over to Amita next.
I would say engaging community is hard, and bringing folks to the table with their own diverse agendas and areas of interest is challenging. I think for us, one thing that I learned was working in government, we're not trusted. So building trust takes some time, especially when you're dealing with community that's been disproportionately impacted by interventions that we had previously put into their communities. Building trust is going to take time. The transparency is needed. And that's something that I would encourage anyone who's looking to do something similar like this. And I want to just plug, and I think we're the only local health department that was actually able to bring community and government together to create a product. And it was through transparency, it was through shared understanding and a lot of tears, blood, sweat, but at the end of the day, we all had a vision and we made it happen by producing the New York City Standards for Respectful Care. I just want to acknowledge our SRJ-CEG group. This is not a health department document or tool. This was something that was created by community for community. It was not, the health department helped support it. But yeah, transparency and trust.
Yeah, and just to add to that, I think the third part of that triangle, right? It's like community, then government, then clinical providers is really connecting the community to the clinical piece. There has always been a great divide, right, between community that are being served and the people providing the services. And we really had to try to bridge that gap as a governmental agency. We're bringing community together. We're also bringing clinical providers together. So one lesson is that there really has to be an enabling environment within the clinical setting for this kind of transformational work to happen. So we really try to do that by speaking to the leadership at the hospitals and really creating that space for providers to learn. A lot of them did not know about reproductive injustices in the United States and the continued, disrespect and ignoring of Black and brown women in the space. And so we really tried to create that opportunity for them to speak to the birth justice defenders, to speak to the community members, and understand really the importance of moving towards a a respectful care, maternity care model.
Well, this has been an absolutely wonderful session, and I hate to cut it off because I feel like there's so much knowledge being shared and that we could just go on, but I know that there are other sessions that are about to begin. Thank you so much for sharing your wealth of knowledge with us, and thank you. I feel like the point you ended on about transparency and trust, bridging that divide between clinical practice, community, and government is just so key. And thank you also for the references that you put in the chat about how we can find out more about your work. Thank you so much. Did anybody from the panel have any final words? Okay, well, thank you so much and take care. Enjoy the rest of your day.
Thanks, everyone. Bye.
Thank you. Bye-bye.
Thank you. Bye.
Okay.